concepts through the collaborative effort between all the members of health sector as well as the sectors that influence health. Today's webinar, the ripple effect, how stronger health systems improve global health priority, will explore how building resilient health systems can lead to better outcomes for global health, focusing on the positive impacts of strengthening health infrastructure across diverse regions and settings. And to join us today, we have our speaker, Mr. Tambe Elvis Akem, a distinguished expert in global health, health specialist in emergencies. He's an epidemiologist and public health physician with an extensive experience across Africa, Europe, and Asia. He specializes he specializes in coordinating and conducting epidemiological studies in humanitarian settings. His work has spread to diverse regions where he has led and supported public health programs aimed at addressing critical health challenges. We're very grateful to have you here with us, sir. The session will run for approximately 45 minutes, followed by a Q&A session. We encourage you to put your questions in the chat box throughout the webinar. We will address them in the end. A quick reminder, please ensure your microphones are muted throughout the webinar to avoid any background noises or any disturbances to the speaker. This webinar is being recorded and the recording will be shared to all of the participants afterwards. For any difficulty, feel free to message in the chat box. We'll address it as soon as possible. So without any further ado, please join me in welcoming the speaker, Mr. Elvis. Over to you, sir.
Hello, everyone. It's a pleasure to be part of this webinar. And I'm just going to share my screen right away. And also thank you for the warm welcoming speech. Share. The slide is not moving. Okay. Okay, so it's fine. So thank you for the warm welcome. Maybe I can just put on my camera for some few seconds because the internet connection here is not very good. Yes, so as you rightly said, my name is Tambe Elvis. I'm a medical doctor, and I'm in the public health field and mostly in emergency response in humanitarian setting. Let me see. Okay. So I'm just going to take my camera off. Can you hear me very well?
Yes, sir.
Hello.
Very audible. Yes, you're very audible.
Okay. Yes, so it's a pleasure to be part of this webinar, and we're going to talk about emerging infectious diseases, the opportunities in a vulnerable global health landscape. And you're going to see why I coined this discussion, this topic like this. You're going to see it throughout the presentation. So just to remind you, if you look at my title, you see ADVAC. So that is advanced vaccinology course. And I took this course in India following a scholarship given by CEPI. So this was done in, I did this in Faridabad, the Translational Translational Institute of Health Science and Technology. Yes, so we go right away. And also, just to remind you, I'm presently in Democratic Republic of Congo, where we're responding to the Mpox outbreak. The slide is not moving. Okay, so this is just a disclaimer to ensure that my presentation and discussion are just my views and does not in any way represent my organization or any other organization. So during this webinar, we're going to look at this outline. We'll look at the introduction, general context of emerging infectious diseases. We'll look at priority pathogens cited by WHO, and we'll see how strong health system improve global health priorities. We'll also look at the US funding pause and the health impact. And we'll also look at historical case studies and lesson learned, and also immediate actions required. And we'll have strategic recommendation for future, and we'll have conclusion and then questions and answers and discussion. Please, if at any point you could not be able to hear me clearly, just let me know. Yeah, thank you. So we know emerging infectious diseases are diseases that appear in the population for the very first time, or that we have increase in the incidence or geographical range. And we have various types. It can be viral, it can be bacterial, it can also be parasitic disease. And we have several factors that can influence emerging infectious diseases. This includes urbanization, globalization, climate change, all of these associated maybe with environmental changes. And also we have increased human-animal interaction. And of course, we also have mutations of viruses or other pathogens. We have social and cultural practices that as well favor emerging infectious diseases. So in this slide, tackling emerging infectious diseases is very important for us to look at it in the One Health perspective. And the One Health perspective requires the human, animal, and environmental interactions. So while we're able to survey, to carry out investigation of emerging infectious diseases, it will also help give us the capacity to respond to the spread of these infectious diseases. So we know that emerging infectious diseases cause a wide range of course, not only health impact as well as economic and social impact. So I'm going to talk about the polio, and the polio is one of those diseases that I can say is at the verge of eradication. So we know that we have the three different strains of the white polio virus, and we know white polio virus 1, 2, and 3. And we know that the white polio virus 2 and 3 have been eradicated, which means that the white polio virus 2 and 3 is no longer a threat, cannot be located anywhere in the world. However, we have the polio virus type 1, which is endemic in 2 countries, mostly Afghanistan and Pakistan. However, we have the emergence of circulating vaccine-derived poliovirus, especially circulating vaccine-derived poliovirus type 2, following the withdrawal of OPV2, that's the oral polio vaccine type 2, that was in 2016. And it's important for us to know that this has, the poliovirus circulates in the environment, and that is why environmental surveillance for poliovirus is very, very critical, because when the virus is shared in the environment and it circulates for a long period of time, then we start having some type of mutation, or when the immunity of people in that particular location is low, then the virus can easily start causing paralysis. So in the nutshell, I would say that effective and high immunization coverage is very important to tackle this polio. So in the next, in this slide, we're going to see the global distribution of the polio virus. As I said, we have polio, the white polio virus type 1, which is endemic in Afghanistan and Pakistan, while the white poliovirus type 2 and 3 have been eradicated. So no country, no country have this white poliovirus. However, we have the circulating vaccine-derived poliovirus type 1, type 2, type 3, and among these three type 2, circulating vaccine-derived poliovirus type 2, is the one that has been increasing in the in incidence across countries. As you can see in the slide, most of the countries are reporting the circulating vaccine-derived poliovirus type 2. If you look at the legend, yeah, so you have most of these countries have reported circulating vaccine-derived poliovirus type 2, and you know, both environmental positive samples and also human cases. So human cases is being reported as a acute flaccid paralysis. So this, for example, in the US, we had this acute flaccid paralysis. One case was reported in 2022. And you can also see the concentration of the white poliovirus type 1, sorry, in Afghanistan and Pakistan. So it's very, very important for us to intensify vaccination campaign, to ensure high coverage of vaccination across all countries, because polio is a global threat, and it's not only located in one country. So just to say that for this circulating vaccine-derived poliovirus type 2, we have the novel OPV2, novel oral poliovirus vaccine type 2, which is being used to respond to this outbreak. Yeah. So according to WHO, we have high-risk viruses. These are viruses that pose risks for public health emergency of international concern, or a pandemic. As we have seen with COVID-19, we have Ebola, the Ebola virus, and presently we have the Sudan Ebola virus, which is a circulating in Uganda, and WHO and other partners are responding to this outbreak. We have the Marburg virus, which is currently circulating in Tanzania, and the WHO and other partners are also responding to this outbreak. So these are all infectious diseases that pose a risk of public health emergency of international concern. We have the Lassa fever, which is endemic in the part of West Africa. We also have the Middle East respiratory syndrome, and we have the severe acute respiratory syndrome. So out of these high priority pathogens, we also have antimicrobial resistant bacteria, including we also have cholera, we have plague, we also have TB, we have extensive resistant TB. Then we have another concept of pathogen X, or they call it disease X. So WHO actually places name pathogen X for diseases that have the potential of causing an epidemic or pandemic. So that's why it's called disease X, because it has this potential of causing a pandemic or an epidemic. So if we look at this timeline of emerging infectious diseases, we have diseases, as I said, emerging infectious diseases are those diseases that appear for the very first time, or maybe we have increasing incidence or in appearing in a different geographical setting. So as we look at this timeline, we see the red represent diseases identified in new area. So like you have an area that has never had for example, we take, for example, Mpox. We have countries that have never reported Mpox, but because of since the global outbreak in 2022, in which WHO declared it as a public health emergency of international concern, many countries started reporting cases of Mpox. And we also have a Marburg virus, in which in 2022, Ghana reported it for the very first time. So it's very, all of this shows that the global collaboration and coordinated response is very important in tackling emerging infectious diseases. Because a disease that is not present in a particular country at a particular time does not mean that that disease cannot be there in the future. It requires coordinated system to ensure a global health security. So if we look at this global, this map, which shows the general view of emerging infectious diseases across countries since 2003. So you can see that these diseases are not just located in one particular country. You have different diseases in different areas, and some other diseases can emerge in an area that has never reported that type of a disease condition. Like we see for example, in Africa, we were not reporting cases of dengue, but because of maybe climate change and other factors, some countries in Africa have started reporting dengue for the very first time. So it's very important for global collaboration to ensure global health security. So how stronger health system improve global health priorities? So after seeing all these pathogens or all these disease conditions that can cause a pandemic or widespread epidemic, following WHO recommendation is to expand disease surveillance and early warning system. We have different type of disease surveillance system. We have indicator-based surveillance. We have event-based surveillance. So depending on the context, any of these or all of these can be implemented. And this actually help to detect diseases early enough before they become a threat to the community or globally. And it's very important for us to continuously invest in the production of antivirals and also vaccines. We have the global network for sharing, for production of diagnostic tools, and also for sharing biological samples is very important for us to produce antivirals and also maybe vaccines. And global collaboration is very important for the development of medical countermeasures, for example, personal protective devices and other for masks and other measures that can help us to be able to tackle specific pathogens. And of course, we have enhancing clinical trial infrastructure for rapid evaluation of new treatment. I give you an example. Presently, we have the outbreak of Marburg virus in Tanzania, and the WHO and other partners, they are using this opportunity to be able to carry out clinical trials for for a vaccine against this virus, because we don't have a vaccine against the Marburg virus. So when we have an outbreak like this, it's an opportunity for the pharmaceutical company to be able to do a clinical trial. Similarly, the current outbreak of the Sudan Ebola virus in Uganda is also an opportunity for the pharmaceutical companies to carry out these clinical trials to be able to develop vaccines and other medical countermeasures against this disease condition. Now, as I'm sure we all have heard about the purse of US funding in the global health landscape. So while we acknowledge that it is a threat to the global health, it's also an opportunity for us, for countries to sit up and be able to ensure a robust system for responding to diseases. We'll look at what the U.S. global funding has done in terms of in the global health landscape. Firstly, the U.S. funding is very important in surveillance and early detection. We have the US CDC Global Disease Detection Program support real-time disease tracking in multiple regions, especially in low and middle-income countries. This is very important because the earlier you detect a disease condition, the earlier you are able to put in place measures to prevent the spread of this disease condition. The US funding is also important in vaccine research and also development. For example, we have the accelerated vaccine research for diseases like Ebola, Lassa fever, COVID-19, and more. And it's also important in collaborating with other partners, WHO, Gavi, CEPI, in driving vaccine access and distribution globally. The US funding is also important to ensure responding to health emergency, especially in Africa, Asia, Latin America. And of course, we have the support of US funding for HIV and AIDS. US funding is also important to building capacity for epidemiologists in different countries. Over 70 countries benefit from this US funding in terms of capacity building. And of course, we have investment in laboratory capacity, emergency medical teams, and also for pandemic preparedness. So what will happen now that this funding is paused for 90 days, and maybe thereafter, it will not be there again, or maybe they're going to strategize. So many things are going to happen looking at the global health landscape. First of all, there's going to be a problem, will have immediate effect on the global health preparedness. So which means that in case of an emergency, an outbreak that has a potential to become a pandemic, the preparedness is low, and hence it's going to affect the response. The disease surveillance in low and middle income countries is going to be low, which means that a disease can spread rapidly because it's not being detected early enough. And since some of these countries will not be able to carry out real-time monitoring to be able to detect a disease before it becomes an epidemic and spread widely. Of course, some research programs, especially for some vaccine and other treatment trials, are going to be affected. And there are some clinical trials that have already been going on. And if they don't have this funding, those clinical trials are going to stop. And it's an ethical issue because for those who have already enrolled in these trials, they're not going to have an endpoint result. So it's an ethical issue as well. And of course, we'll have responding to health issues in humanitarian areas to become an issue. So if we look at the historically, we look at some outbreaks that have occurred in recent time. For example, we have, I'll just talk about the current outbreak of Mpox. Mpox, as you know, is a public health of emergency of international concern, which was declared last year, August 14. And this Mpox has the various clade, and the most interesting of the clade is a Mpox subclade 1B, which is spreading rapidly. And initially the Mpox was like more of a zoonotic transmission, but due to mutation we now have the subclade 1B, which has the human to human transmission. So it's very, very important, and we have issues with respect to the limited diagnostics, limited vaccines to help counteract this outbreak. As also we've seen delays during the COVID-19. We had delay in vaccine development and also response and all of this. So these are all things that we've gone through, and of course it helped to guide us in current outbreak and also for future outbreak. So looking at all of this with respect to this global cause by the US, first of all, I would say that it's very important for countries to strengthen their domestic funding in terms of health security. So the low and medium income countries have to put in place finances that can help to protect the security of the country. And also countries have to work together, collaboration, because when it comes to health security, no country can do it alone. It requires collaboration in the production of, sharing of data, production of medical countermeasures, production of vaccines. So it requires a lot of collaboration. So we believe that maybe after the 90 days funding pause, the US will going to come back to, to collaborate with other partners to ensure global health security. And as I said, strengthening research. Countries should work together to strengthen research, building capacity, and do exchange program. Like as I said initially, for example, the vaccinology course that I did in India was a funded program by CEPI. So all this type of exchange program help to build capacity in responding to public health emergency. So in conclusion, emerging infectious diseases are relentless. So whenever there is a gap in the health system, as we have currently with this course of the funding by the US, then if nothing is done, then we should be ready to, maybe in the next months or so, we should be ready to, to welcome this type of infectious diseases that can be a global threat. So I will say that it's the time for us to act is now to ensure global health security. So that was one of my references. And so thank you very much for listening. Hello.
Hello, am I audible?
Yes.
Okay, thank you so much for the session, sir. It was a very engaging and a very insightful session. Does anybody have any questions? There's none that I see on the group chat. Anybody, any questions? If you'd like, you can unmute and ask as well.
Yeah, so if you maybe any question or comment, yeah, it will be very interesting to engage in this discussion.
Okay, so I don't think we have any questions from anybody, any participant. Okay, so we have a question from Suhaila. The question is, what may be different means to acquire alternate funding for governments? Question for you, sir.
Eh, okay, yes. So thank you very much for that question. And we have different funding mechanism. For example, when we come to, the vaccines supplied to different countries, we have the Gavi, which mostly subsidize vaccines and provide vaccines to countries at very, very low cost. Gavi focuses on low and middle income countries for vaccine supply, and working in collaboration with UNICEF, they help to make the vaccines available, and while UNICEF ensure the procurement and shipment of the vaccines. We have other organizations that as well help to provide funds for research, vaccine research. We have many of those organizations, including the Bill and Melinda Gates Foundation, which is also very much involved in polio eradication and also for vaccine research in vaccine development. We have there are many other organizations that are involved in vaccine. We also have the IVI in South Korea, which is also involved in vaccine production. And recently, they have a regional center in Africa that is also they are also helping to expand vaccine production in different regions. So the government as well, they can be able to use their own resources to fund their program. For example, I give you, for example, for example, taxation. We have some goods that are detrimental to human health. So if the government is able to levy high taxes to this type of goods and then deviate these taxes to improve the health system, that is also a very good example on how the government can generate income to improve the health system. For example, we have things like maybe cigarettes, uh, alcohol. The government can increase taxes for this type of goods and then use the tax and in the development of the health system of the country. So in this way, the government will not only rely on external funding, but they will be able to generate their own funding to fund their own healthcare system, especially for very critical services. For example, HIV drugs. I'm not sure the government should rely solely on external funding to provide HIV drugs to those who need them. The government should be able to generate funding for this type of purpose, and even any other program that requires continuous funding like this. So yeah, so in general, the government should be able to provide essential services through their own funding, yeah, to sustain, services. So I don't know if I've been able to provide sufficient response to your question. Okay, thank you. Thank you.
Thank you, sir, for that. Are there any other questions? Anybody else? Okay, so I think that there's no questions. We have come to the end of the session, sir. Thank you so much for your insightful and informative session. Your expertise and perspectives have provided us with valuable knowledge. I'd like to extend a big thank you to all of the participants here for joining us today and for the question that was put up. This is just one of the many exciting sessions we have planned for the future. We'll be hosting more webinars in the upcoming days, so stay tuned for announcements from HPHTO. Make sure you follow us on Instagram, LinkedIn, and WhatsApp to stay updated on our future events as well. Your feedback is incredibly important to us. It helps us improve and tailor future webinars to better meet your needs. Please take a moment to fill up the feedback form, which I'll post in the chats in a few minutes. Sorry. Once again, thank you all for being a part of today's webinar. We look forward to seeing you at our upcoming event. Until then, stay curious and stay connected. Thank you so much. Thank you so much.
Thank you so much. Thank you so much for the invitation. Thank you.
The link has been posted. Please fill in the form. It would be much appreciated. Thank you so much.
Thank you. Bye-bye.
Bye-bye.
Bye-bye.